Hello, mates. Hope you are all doing great and you're all in your good health and you're all focused, dedicated towards your tasks. Today, I'm going to talk about the cerebellar haemangioblastoma. Cerebellar haemangioblastoma happens to be a benign tumor. It is usually seen in the posterior fossa, and it is composed of thin wall blood cells because it involves the endothelial system. So far, the clinical symptoms are concerned, the patient will come with the nausea, vomiting, ataxia, vertigo. All these symptoms would be associated with the cerebellar hemangioblastoma, and it is usually seen in adult or young adults with a male predominance. If there is multiple cerebellar hemangioblastoma, you may think of von Hippel-Lindau disease. So how it will appear on the images and how we will appreciate on the CT and MR. So for the angio is concerned, because of the blood, you may be able to see a vascular nodule within a avascular mass. So this is one of the characteristic on the angio for the cerebellar hemangioblastoma. So how it will appreciate, how it will be presented on the CT or MR images. Let's start watching these images. On this axial image, you can appreciate a well-defined, predominantly cystic mass with slightly surrounding enhancement, and another important point is with a intramural nodule. There is also hemorrhage within that, and there is a surrounding edema visible. As far as this intramural nodule is concerned, it will enhance if you give the contrast to the patient. And if you do an angiogram, on the angiography you will be able to see that there will be an enhancing intramural tumor with an unenhanced lesion. So this is how the cerebral hemangioblastoma will look on the CT images. On this contrast enhanced axial image, you can appreciate that in the right cerebellar hemisphere, a well-defined, predominantly cystic lesion having intramural nodule, intramural enhancing nodule. This entire lesion is surrounded by the edema. You can see that there is edema around that. So this is what the cerebellar hemangioblastoma will look like, and this is if you do an angiogram. So post angiogram you will see a vascular nodule with an avascular lesion. In on contrast enhanced CT axial image indicates an ill-defined predominantly hypodense lesion. This may likely be due to internal hemorrhage. It had been bleed, so that's why it appears as an hypodense. If you look for the surrounding parenchyma shows edema, and so far the location is concerned, it is the left cerebellar hemisphere. So this is what characteristically cerebellar hemangioblastoma will appear on the CT images. Another post contrast axial CT image of the brain showing a posterior fossa, well defined, predominantly cystic lesion with a post contrast enhancing intramural nodule. So you can see this is a cystic lesion. Within that there is enhancing mural nodule, and it causing sufficiently compression on the surrounding parenchyma, resulting into the surrounding edema. On the angiograph it will give rise to a vascular nodule within the avascular lesion. So this is typical cerebellar hemangioblastoma. Here on this image you can appreciate a very small posterior fossa, predominantly cystic lesion with intramural enhancing nodule. This is a post contrast image, and this is cerebellar hemangioblastoma, and it enhances after the contrast injection, especially the intramural nodule. However, entire lesion would be hypodense or avascular. This causes significantly surrounding edema, but as being a small in size, you cannot appreciate significant surrounding edema in particular this case. As in the introduction, I've explained that this is mainly a benign tumor with a thin wall blood vessels, and the patients will be with a complaint of headache, ataxia, nausea, and vertigo. And the only presentation that you may be able to see would be an predominantly cystic nodule, which you have already seen on non-contrast images, and even on contrast images you have noticed that there will be intramural nodule which will be enhancing after contrast injection. Beside this, there may or may not be hemorrhage depending upon the case and depending upon the age of the lesion. And the second thing is, as it's a space occupying lesion in the cerebellar region, it will cause significant surrounding edema. The second thing is, if you do the angiogram, so angiogram is particularly gold standard for that, and you will be able to see that there will be a enhancing intramural nodule within non-enhancing lesion. So I do hope that this video will be quite sufficient for you to understand the cerebellar haemangiblastoma, which is a benign tumor of the brain, and you will definitely benefit from it. Keep watching my video, keep subscribing, keep sharing this, and with some other brain tumors video we'll see each other. Till then, take great care of yourself. Thank you.